Hello, everybody. My name is Evelyn Punzo, and today I'm going to talk about job descriptions and training of healthcare administrators in California. This includes responsibilities, salaries, skills, and challenges and education requirements. Being a healthcare administrator student, I wanted to learn more about the field, my future roles, and what should I expect. I will discuss the challenges human resources management face, as well as what job descriptions, training, and some solutions that can be considered. Healthcare administrators are responsible for the planning, administration, and organization of the health and medical services. Healthcare administrators oversee in hospital clinics, separate units or clinical areas, medical and testing labs, private medical services, and other facilities. Unlike most workers in healthcare industry, healthcare administrators usually do not work directly with patients. They help ensure that the facility is well managed, that the staff are happy working there, and that the facility makes expected finances. So one thing is, according to the Bureau of Labor Statistics, the entry level salary for a healthcare administrator is over $58,000 per year. That is slightly higher than the national average. There are a few skills that you would need as a healthcare administrator. For example, you have to have good communication skills, good analytical skills, leadership skills. Also need to understand the regulations of the organization that you work for and state, whichever state you work for. You also need to know medical terminology so you are able to understand your physicians and your nurses, anybody who you manage within that organization. Implementation of electronic health records and improved protection for cyber attacks are two of the obstacles you would face as a healthcare administrator. Healthcare administrations must develop a strategic plan and policies to recruit, hire, and retain qualified healthcare professionals. So, since the Affordable Care Act passed in 2010, the demand for healthcare workers is very high. As the population has grown in California, more healthcare professionals are needed. So, as a healthcare administrator, you are to seek the best protection on patient information. So, according to the IBM, over 1 million patient records are out there, making it top sector target. Hackers surpassing even the bank and financial industry. That's one thing I found very interesting, that patient records are being sold on the black market. So a solution for preventing staff shortages would be creating an environment where a healthcare professional would like to be part of, and it's essential to prevent staff shortages. Job satisfaction is a dependence on the administrator. They're building a smart recruitment strategy to define your organization from others through unique branding, benefit packages, compensations, and cultures. As a leader of an organization, the least you want is staff shortages, because the less people you have, the more negative patient outcomes you will have. To increase the number of candidates who accept letters of offers, healthcare organizations need to ensure that their brand of employment is decisive. One of the best ways to do this is by highlighting the company's cultures and benefits, because that let alone will attract a physician or a registered nurse to apply for that company. One of the best ways to do this is by highlighting the company's culture and benefits. Healthcare providers may also participate in personal employee branding activities, such as maintaining a presence of local fairs and sending talent teams to work secret events or local medical and nursing schools. The applicant also looks for a comfortable organization. Solution for increasing cybersecurity. It's vital for you to ensure that the medical organizations you're working for maintains a budget and a good legal counsel to keep records safe. Establishing a security culture for ongoing cybersecurity training and education that emphasizes every member of the organization to be responsible for protecting patient data. If the organization has a BOYOD program, which is Bring Your Own Device program, healthcare professionals must implement encryption in the devices and other protective measures to ensure any information on these devices are secure. Proper training should be provided to healthcare professionals or even employees coming on board. And if proper training is not implemented, errors tend to happen often. As an organization, you are to plan for an unexpected and have files regularly backed up and quick and easy restoration. And it is recommended that you should consider storing information away from the main system if possible. Solutions to tackle the challenges of the cybersecurity will create a better culture and security. Hospitals are often the weakest link in the cybersecurity training chain, and preparation can go a long way to teaching a doctor and a nurse how to protect against attempts. Ensuring all computers used by the facility staff have antivirus systems and other measures. It is important that the healthcare administration can get the best plan to avoid any attacks from happening, but then again, having the best plan at the best price, that way you're meeting your finances. Meeting with your IT department every week to ensure all employees' passwords are updated and secure. So in conclusion, healthcare administrators play a vital role in the healthcare industry. So as California has the highest medical health services employment level in the country, job prospects in the state are up and coming by boomers generations is getting older, and there will be more need for quality health services. Job placement can vary, but other potential fields can be obviously achieved. Many healthcare administrators decide to pursue their master's degree. Some decide to pursue another career within the healthcare industry. Thank you so much, and that concludes my presentation.